How's it going, guys? Dr. Adrian Chavez here with PersonalTrainingPrep.com, and in this video I want to talk to you about cardiovascular anatomy and cardiovascular blood flow. So these are very important topics that you're going to see if you're taking the ACSM Certified Personal Training Exam. If you've watched my other video where I review the contents of the ACSM CPT exam, you'll see that I was very surprised to see a lot more questions on this material than I expected. There was about 7 to 8 questions, maybe even 9 questions specifically on the material that I'm going to cover in this video. So I want to go ahead and get started. I just wanted you to be aware this is going to be an important topic on the exam. Maybe I just saw a freak exam that had a lot of questions on this, but I doubt that's the case. So you really need to know it. You need to understand it. You can figure a lot of this out by reading the books, but I recommend you watch this video, hear me explain it, and then go and check out some videos online to actually show the visual of it, okay? So let me go ahead and get started. Now, first I'm going to talk about the anatomy of the cardiovascular system. These are the important topics that you need to know. So the heart, obviously the heart is the pump of the cardiovascular system. You need to understand that. The atria are the chambers of the heart that accept blood into the heart. So when blood's coming either from the lungs or the body, the atria are the chambers that accept the blood. The ventricles are the chambers that actually push the blood away from the heart. Okay, so when the heart pumps, the ventricles are what push the blood away from the heart. So when the heart actually beats, the ventricles are contracting and pushing the blood out of the heart. The arteries and arterioles are the blood vessels that take blood away from the heart. The veins and venules are the blood vessels that bring blood back to the heart from the body. And the capillaries, this is the small blood vessels that allow the blood to mix with the tissues of the body. So very small blood vessels, and this is where the blood drops off oxygen and picks up the waste products and starts to bring it back towards the heart and the rest of the body to be filtered out and reoxygenated. Okay, now I'm going to talk about cardiovascular blood flow. This is something that's important. You need to know each step of this. You need to know the valves, you need to know the chambers of the heart, you need to know where the blood vessels, or you need to know the blood vessels that are supplying the heart, and you need to know the ventricle that actually takes the blood away from the heart, okay? Or not the artery that takes blood away from the heart. Okay, so the first thing you need to know is where the heart, so when blood is coming from the body, where it enters the heart. It enters in the right atrium. Okay, and the right atrium is the side of the heart that accepts blood from the body into the heart, and it goes into the atrium. Then it travels through the tricuspid valve from the right atrium to the right ventricle. Then it travels from the right ventricle and it gets pushed towards the lungs via the, and I actually have to look this up because I haven't taken this test in a while, via the pulmonary artery. I want to make sure I don't mess up for you guys. So it gets pushed to the lungs via the pulmonary artery. Then it returns to the left atrium via the pulmonary vein. So, and these are going to be, the artery is going away from the heart, the vein is going towards the heart. So it gets pushed out from the right ventricle to the pulmonary artery. It picks up oxygen at the lungs, then goes back to the heart via the pulmonary vein. Enters into the left chamber of the heart now, the left side of the heart, into the atrium, because it always enters to the atrium. So it enters the left atrium, and it gets pushed from the left atrium to the left ventricle via the mitral or atrioventricular valve. And then it goes from the left ventricle, and it gets pushed out towards the body, and it pushes it out through the aorta, which is the primary artery in the body. So it's the main artery that takes blood from the heart to the rest of the body. Sorry, I'm getting a little confused here. So it goes through the aorta, and I just watched this video a couple of times, take some notes. You're going to have to learn it, map it out, write it down over and over and over again, and you'll be ready to go. So it goes out through the aorta, travels through the arteries, goes to the arterioles, then the capillaries. So the arterioles are just smaller arteries. So it just branches down, goes the arteries, the aorta is the biggest artery, then it goes to smaller arteries, and then it goes to the arterioles, which are even smaller, then it goes to the capillaries where it mixes with the tissues, drops off the oxygen, picks up the waste products, then it goes to the venules, then it goes to the veins, then it comes back to the heart via the inferior and superior vena cava. So inferior means the lower vena cava, superior means the upper vena cava, comes back to the heart via the right atrium. Okay, so remember that right side of the heart is where it accepts blood, or right side of the heart is what gets the blood from the body, left side of the heart is what gets the blood from the lungs. And the atrium are what accept blood, ventricles are what push blood away from the body. So if you remember those couple of things, you can guess most of it just by reasoning. But you really need to memorize these valves, you need to memorize these veins, the inferior and superior vena cava. You need to know that those are the primary veins that bring blood back to the heart. You need to know the aorta, you need to know the pulmonary artery and valve, you need to know what veins, venules are, arteries, arterioles. You need to know the right side of the heart, you need to know what the right side of the heart does, you need to know the difference between atria and ventricles, and you need to know the valves. So the tricuspid valve is on the right side of the heart. It's between the atrium and ventricle, and the mitral valve or the atrioventricular valve is on the left side of the heart. It's between the atrium and ventricle there. Okay, so watch this video again. I know there's a lot of information, but you're going to need to know this stuff. So watch it over and over and over. Take some notes. Make sure you understand it. And if you're interested, and if this content, you like the way I explained it, I actually have a course available online to help you study for the ACSM Certified Personal Training Exam. I know many of you have already probably purchased the books and you just found me along the way because you're having trouble studying. My course is priced very economically, and I think that it will be worth it even if you've already bought the books. If you haven't bought the books and you're just looking around, you're thinking about studying for the exam, or you're just trying to study without the books, which I don't recommend, check out my course. I offer a 3-day free trial. Go check that out, no obligation. You don't have to put a credit card number or anything in. You go check out that 3-day trial, see if it's right for you, see if it's worth the money. If it's not, no big deal. I have more videos on here. You can check those out. You can learn from those. I appreciate your time, and I look forward to talking to you soon.